Hi, I'm Rory Green from XR Today, reporting from Immerse Global Summit 2023 in Orlando, Florida. Joining me today is Dr. Ciavarelli from HouseCall VR. Thank you so much for taking the time with me today. And I'm interested in learning about what brings you to the event today and to learn a little bit more about your keynote that you had earlier.
Yeah, so first of all, thank you so much for having me. Excited to be here for the second time. Was in Miami last year and really enjoyed the event. We're here today to talk about the intersection of healthcare, immersive technology, and patient education. So one of the spaces that hasn't been as well developed in the healthcare vertical in extended reality is patient education. So as you know, there's a lot of work being done in simulation and training in healthcare as well as direct therapeutics. One of the things that hasn't really been well explored and exactly where our work is in for HouseCall VR is in patient education. I'm a physician. I've been in clinical practice for over 20 years now, and I really see what happens when my patients fundamentally don't understand what's going on in their health. Many people have experiences where you go to the doctor says a bunch of things that you don't understand. They show you a picture that you don't understand and say, look at this black blob, and you say yes. And then you go and you do an internet search. And that's generally the way that we've been educating patients in the way that we educate patients today. So we see at HouseCall VR, we see immersive technology as a completely new way of framing that conversation between the patient and the doctor that gives everyone equal standing and understanding around their health.
Fantastic. And I think the word in technology standards, the word democratization is thrown around a lot. So in terms of healthcare, could you define for us what democratization of healthcare means, I guess, for patients and doctors, and then equally, how does XR fall into that?
So that's a great way to look at it. You know, for us, creating something that allows people to fundamentally understand what it is that's going on with their health, which is, you know, you can define that as health literacy, which is the ability to understand, interpret, and act on the healthcare information that you're given. And when people don't have that ability, when they don't have that literacy, we know that they have worse outcomes, they have more prone to chronic disease and, a host of other factors that not only are impactful for the patient, but are also impactful for the economy of medicine. So we know that there's a space for expansion, a place for us to look, and we see immersive technology as a way to do that if it's deployed properly. Our clinical solution is deployed in a healthcare setting. So it is for anyone who has access to that healthcare, they'd have access to the solution with a follow-up application on a mobile device.
Fantastic. And just to go back to the patient side, you talked a bit about how XR can help patients, generally speaking. In terms of HouseCall specifically, how is your product, how is your service helping patients get the right treatment they need?
So what we see immersive tech, specifically patient education, as a way to give patients agency. We know that the way to give people power is through knowledge. And when we give people power and knowledge we give people knowledge of their health conditions, we're ultimately giving them agency and allowing them to control their destinies. So giving people the ability to deeply, fundamentally understand and advocate for themselves, we see is part and parcel with health equity.
Fantastic. And then flipping that over to the doctor and healthcare professional side, how does XR generally, and then also again with HouseCall specifically, how does it help these healthcare professionals in achieving their goals and again, helping the patients in the long run?
Sure. I mean, like I said before, there's a lot of work that has been done in simulation and training. So training for healthcare providers to do technical tasks, training them how to interact with patients better. There's some, that's really fantastic. That's what's happening in those spaces. Also with direct therapeutics, now there's FDA approved therapy for a variety of conditions in leveraging immersive technology. What we see is the ability for patients to fundamentally understand their health, and specifically going into that space where we talked about before, where you go see your doctor and you walk out with more questions than answered, and you're sort of left on your own. So we see that from the patient perspective. Now, from the provider perspective, it allows us to standardize the education that we're getting. Right now, one doctor might give you one explanation, another might give you another explanation. We have standards around treatment protocols, but we don't have a lot of standards around education of patients and giving them that agency. So that, and from an efficiency standpoint, I spend a lot of my time with my clinical practice. I'm still in clinical practice 2 days a week, educating my patients and taking that, if we can standardize that and leverage immersive technology to do better, that can transcend time, it can transcend culture, it can transcend language in ways that one person can't always.
Fantastic. I like that word of standardization. When you come to standardization, do you feel that the standardization of technology and then immersive technology and immersive software too, do you feel that that's key to driving healthcare adoption of XR across? Because it's obviously a big player in terms of end users.
Absolutely, absolutely. Standardization is one of the opportunities that we're all looking for, and we've tried in electronic health records to standardize these things. Healthcare, particularly in the United States, but globally, is really fractionated, it's siloed, it's difficult to share information. So as we move forward with immersive technology or all technology, I think one of the grand goals is to have standardized not just processes, not just specifically what HouseCall VR is working on, but across the sector.
And one other point as well, obviously healthcare employs a big range of technologies from emerging to legacy tech too. What hurdles have you faced trying to get that interoperability between what I imagine is some very old hardware and software alongside new stuff like HouseCall?
So great, another great question. To be honest with you, it's a challenge, but coming as a clinician, someone, like I said, with decades of experience in hospital settings, private care settings, home settings, all kinds of variety of care settings, really deeply understanding how these systems work and understanding what the clinical limitations are, where there's time limitations, where there's staff limitations, and being really thoughtful about that in our development process. So leveraging strategic partnerships to identify exactly what it is that people need and how we can integrate thoughtfully into clinical practice. I think that's really where we are with that.
Fantastic. Thank you so much for those questions. Super insightful. I'm Rory Greener from XR Today. Thank you so much for watching.